Good afternoon, my name is Zoraida Jancura Fremont 10. This video is for the assignment for VN 301. The source of this video is from Children's Hospital of Philadelphia. What is postpartum hemorrhage? Postpartum hemorrhage is an excessive bleeding following the birth of a baby. About 1 to 5% of women have postpartum hemorrhage, and it is more likely with the cesarean birth. Hemorrhage most commonly occurs after placenta is delivered. The average amount of blood loss after the birth of a single baby in a vaginal delivery is about 500 ml, or about half of a quart. The average amount of blood loss of a cesarean birth is approximately 1000 ml, or 1 quart. Most postpartum hemorrhage occurs right after delivery, but it can also occur later as well. What causes postpartum hemorrhage? Once a baby is delivered, the uterus normally continues to contract, tightening of uterine muscles, and expels the placenta. After the placenta is delivered, these contractions help compress the bleeding vessels in the area where the placenta was attached. If the uterus does not contract strongly enough, called uterine atony, these blood vessels bleed freely and hemorrhage occurs. This is the most common cause of postpartum hemorrhage. If small pieces of the placenta remain attached, bleeding is so likely. Some women are greater risk for postpartum hemorrhage than others. Conditions that may increase the risk of postpartum hemorrhage include the following: placental abruption, or the early detachment of the placenta from the uterus; placenta previa, the placenta covers or is near the cervical opening; overdistended uterus, excessive enlargement of the uterus due to too much amniotic fluid; or a large baby, especially with birth weight over 4,000 grams or 8.8 pounds. Multiple pregnancy, more than one placenta, and overdistension of the uterus. Gestational hypertension or preeclampsia, high blood pressure of the pregnancy. Having many births or prolonged labor, infection, obesity, medications to induce the labor, medications to stop contractions for preterm labor, or use of forceps or vacuum-assisted delivery. General anesthesia. Postpartum hemorrhage may also be due to other factors including the following: tear in the cervix or vaginal tissues, tear in the uterine blood vessels, bleeding into concealed tissue area or space in the pelvis, which develop into a hematoma, usually in the vulva or vaginal area. Blood clotting disorders such as intravascular coagulation. Placenta increta, or the placental tissues invade the muscles of the uterus. Placenta percreta, the placental tissue go all the way into the uterine muscle, may break through or rupture. Although an uncommon event, uterine rupture can be life-threatening for the mother. Conditions that may increase the risk of uterine rupture include surgery to remove fibroid, tumors, and a prior cesarean scar. A prior scar on the uterus in the upper part of the fundus has a higher risk of uterine rupture compared with a horizontal scar in the lower uterine segment called a lower transverse incision. It can also occur before delivery and place the fetus at risk as well. It is important to know the signs and symptoms of the postpartum hemorrhage. These are the followings: uncontrolled bleeding, decreased blood pressure, increased heart rate, decrease in the red blood cell count or the hematocrit, swelling and pain in tissue in the vaginal and perineal area if bleeding is due to a hematoma. The symptoms of postpartum hemorrhage may resemble other conditions or medical problems. Always consult your doctor for a diagnosis. Treatment of a postpartum hemorrhage. Specific treatment postpartum hemorrhage will be determined by your doctor based on your pregnancy, overall health and medical history, extent of the condition, your tolerance of specific medications, procedures, or therapies, expectations for the course of the condition, your opinion, or your preference. The aim of the treatment of postpartum hemorrhage is to find and stop the cause of bleeding as quickly as possible. Treatment for the postpartum hemorrhage may include medication to stimulate the uterine contractions, manual massage of the uterus to stimulate contractions, removal of placental pieces that remain in the uterus, examination of the uterus and other pelvic tissues. A Foley catheter could also be used to compress the bleeding inside the uterus. Packing the uterus with the sponges and sterile materials may be used if a Bakri balloon or Foley catheter is not available. Trying off bleeding blood vessels using uterine compression sutures. Laparotomy. It is a surgery to open the abdomen to find the cause of bleeding. Hysterectomy. Surgical removal of the uterus in most cases. This is the last resort. Replacing the loss of blood and fluids is important in treating postpartum hemorrhage. Intravenous IV fluids, blood, and blood products may be given rapidly to prevent the shock. The mother also receives oxygen by mask. Postpartum hemorrhage can be quite serious. However, early detection or quick detection and treating the cause of bleeding can often lead to a full recovery.